Te ofrecemos medicamentos genéricos de calidad, siempre con precios justos, porque nos preocupamos por ti y tu familia. Prueba y convéncete. Farmacias del Dr. Simi, lo mismo, pero más barato.
Dr. Simi was the very first pharmacist I knew. I grew up on the idea that pharmacists were there to help families in need, that they wanted to help those who couldn't afford it. And while that may be true in Mexico, I soon realized the big difference with the pharmaceutical industry in the United States. While pharmacists may still hold those values, the industry makes it extremely hard for them to do so. Not just pharmacists, but all healthcare workers alike. Many like me strive to go into this field because we want to give back to our community and be someone that people can come to when in need. But the truth is that the greed that those who are higher up have will prevent that. Many students like me spend hours and hours in lab preparing for one day to be in pharmacies and hospitals. We hope that these skills we are building will prove to be worthy enough of our desired career. But am I continuing down a path that I am bound to hate? I'm doing all of this because of the passion I have for science, health, but most of all, community. I know how difficult it will be to help my community because there's so much more to the pharmaceutical industry than just pharmacists. Pharmacy pricing can be a lot more complicated than many people realize. So first, we have a pharmaceutical company, which creates a drug and then sets it at a list price. Then, insurance companies have their PBMs, which are pharmacy benefit managers, go in and act as middlemen. And so they negotiate with the pharmaceutical company and ask them to pay rebates. And so the higher the rebate they pay, then the higher their drug will be on the formulary. The formulary is basically a list of drugs, and the higher the drug is on the list, then the bigger the portion the insurance company will cover for their patients. And so the pharmaceutical company will want to be higher on that list so that patients are more likely to buy it. And so PBMs then keep part of this rebate, and the rest of the money goes to the insurance company. This causes the drugs to raise in price because the pharmaceutical company will pay higher rebates and therefore increase their price to match that. Then, finally, at this new price is when the pharmacies and the pharmacists can then sell the drug to their patients.
Daraprim is on the World Health Organization's model list of essential medicines, an invaluable weapon in the fight against malaria and a serious infection caused by HIV. A young U.S. financier, Martin Shkreli, manager of a hedge fund investing in health products, bought the rights to the drug in the United States. He then bumped up the price of Daraprim from $13.50 to $750, a 5,000% increase.
Pharma greed kills. Evil, not profits. Pharma greed kills. Evil, not profits. Pharma greed kills.
Martin Shkreli was a pharmaceutical company CEO, which goes to show that many in this huge chain of big pharma are the problem. His greed is reminiscent of the majority that take part in this pyramid.
Up here.
If you could rewind the clock a few months, I wonder if you would do anything differently.
I probably would have raised the price higher.
And as much as healthcare being a right for all may seem like something hard to disagree with, the truth is that many believe that way. And by many, it is those that are so high up they don't need it, and instead believe that the money could go elsewhere, perhaps their pockets.
You're right. The healthcare. Look, I don't want to argue. The healthcare system, in my view, is broken. It's dysfunctional. But my question to you is a simple one. As an advisor to the president, do you think we should join every other major country on earth and say, you know what? Whether you're poor, you're rich, you're young, you're old, healthcare is a human right. We are the richest country in the history of the world. Do you think we should do what every other major country on earth does?
Senator, I think it's important to provide legitimate, evidence-based outcomes for people within the healthcare system, and to make sure that we tailor all of the dollars that are spent towards.
But that, you didn't answer my question.
That they have good
Mr. Vogt,
healthcare.
my question, fine. Question is a simple question. In America, should we do what every other major country does and say, I don't care if you're poor, you're rich, you're old, you're young, healthcare is a human right? Yes, no?
Senator, I think the president has not made he ran on providing good healthcare outcomes. That's my view.
You're an advisor to the president. You're going to be a key advisor if you are approved. Do you think that healthcare is a human right that every American should be entitled to?
I believe the role of the Office of Management Budget Director is to take what the president has run on, the things that the president has as a policy agenda, and to turn that into policy, to
Healthcare
implement.
CEO Brian Thompson was gunned down in New York, and that massive manhunt is still underway for his killer in what police are calling a calculated and premeditated attack. In a new statement, the United Health...
This incident showed the United States just how fed up our community is. And while many may not believe the lack of mercy for that CEO, the truth is that many insurance companies are like that.
This killing has generated a very different reaction from some on the internet. Just take a look at some of these comments.
Insurance companies like these, known for their high rates of denial, are the ones who truly show no mercy. When those are at their lowest and their lives are at risk, these insurance companies meant to be there for them will turn their backs.
The New York Times writes this, quote, "The dark commentary after the death of the 50-year-old insurance executive from Maple Grove, Minnesota, highlighted the anger and frustration over the state of healthcare in America, where those with private insurance often find themselves in Kafkaesque tangles while seeking reimbursement for medical treatment and are often denied." And that frustration is something that doctors say they've seen from patients throughout their careers.
I see people when they're at their lowest, when the system has failed them, and I'm frankly not surprised. They feel abandoned, they feel exploited, they feel lied to when it comes to the healthcare system, and especially insurances, because of the things you mentioned, denials, prior authorization, narrow networks, the cost of healthcare. It's been going on and bottling up for a long time.
We're talking to you about a really powerful, and I would have to say disturbing, essay that you that was published in the New York Times, an opinion essay, where you say that, we talk a lot about how doctors and other medical personnel are burned out. But you say they're not burned out, they're demoralized. Talk a little bit about that. Why do you say that?
Doctors have worked hard for a very long time in the U.S. They have been overworked. They have been exploited by medical systems. Nothing about that is particularly new. In fact, over the last couple of decades, doctors' work hours have declined. We have better working conditions than we used to have. But the pandemic disrupted our impression of the system for which we work. I think one of the most demoralizing things, the things that leads to what is being referred to as burnout, is when the system that you work for is not serving the ends that it claims to serve. We as doctors want to serve our patients. I really believe that about the colleagues with whom I work. And we are constantly failing them, not through any lack of effort on our part, but because our health systems and our welfare systems are not set up to allow us to succeed.
What's your dream job? What do you want to do when you grow up?
I'm going to be a doctor.
Yeah. How much do you want to make?
I'm going to make people feel okay.
Healthcare workers and citizens alike are fed up with the way our system is built to favor those at the top. But as difficult as I know it will be, I still strive to become a pharmacist. I know how difficult it will be for this industry to change, but I still have hope that we can do it, and there's no better way for this to happen than for being on the inside. And I hope that one day I will be able to achieve that little girl's dream of not only becoming a pharmacist, but helping the community that once helped me.